Assalamu alaikum. Welcome everyone on board. Um, Today we will discuss another modality of anesthesia, which is a little less highlighted in our so-called holy books. And unfortunately, when people find these questions in the exam, they find it a little bit difficult because they are not familiar to it. Okay. So, um, what do you mean? What do you think? What is NORA, non-operating room anesthesia? Okay. So we will just try to chalk out what can be the places where like you have need to give anesthesia to a patient outside normal operation theater. Okay. Maybe they are equipped with all the facilities and they should have all facilities, but still this will be considered as non-operating room anesthesia because there will be limited manpower. Okay, there will be less familiar environment. There will be not everyone is doing these cases daily on daily basis. So there will be something tricky. And another thing is that usually not normal patients will be there. Okay, uh, usually the patients who are not commonly dealt with will be there. Like for example, if we just think about MRI, so usually there will be any patients with some neurological problem. Okay, to the for example in babies, there is a very common indication for which they come. It's ADHD, attention deficit hyper. Dr. Ijaz, you don't need to record because you will get the recording. If you want to record still, you can record it. I have no problem, but there is actually no need. You don't need to waste your time. Okay, because I record everything and I put on the YouTube. All the discussions which I do, they are not for any financial interest and they are available. They are for everyone. Okay, so you can find anything anytime. But still, I don't mind if you want to record. Okay, so this is attention deficit hyperactive disorder in which these babies are very aggressive. So, in addition to the concerns related to pediatric patient, you will have neurological problems. So, one of them is ADHD. Okay, then another the patient with epilepsy. Okay, patient with the developmental delay. Like I'm talking about babies. So, whenever you have any patient with developmental delay, you can have uh, some this one other congenital anomalies. Okay, so there will be a chapter which will be like there it is, you can say that it will be a tip of iceberg. If you find a case in MRI, be ready for something is dangerous is in your accept like this is away from the concerns related to MRI. Okay, but you should be thinking the reason for MRI. This is more important because MRI things are predictable. Like there is noise issue. Okay, there is. I will just chalk out the main highlighted point. There is issue with the noise. Okay, there is issue with the low temperature. There is like it's a very cold environment. Then there is limited access. Okay, then there are MRI compatible equipment starting from circuits and machines and monitoring and everything. Okay, so everything should be MRI compatible. Any patient who has any though there are some devices which can accept even implants. Okay, but usually for your exam purpose, you have to tell that usually any metal or anything you cannot you cannot do MRI for those patients. Okay. So these are concerns which are there, but this is something which is predictable. I again repeat, this is predictable. But the other things you cannot predict because you are having a challenging condition like that. Then another thing is that we recently discussed about day surgery. So majority of patients will be as day surgery. So this is another challenge, that you don't want to move the patient, that the patient moves, but you don't want to have a very too much delay in the recovery. So you want fast turnover, and you want the patients to be awake early. So this is another challenging thing. So now if for example in this case, if someone need to know that like PEDS concern, you should be knowing about PEDS concern, then day surgery. Okay, then neurological problem, like uh, especially there can be other problems, but epilepsy. Okay, so whenever the word epilepsy comes, you should be knowing about like anti-epileptic medications. And actually they are friends of anesthetists because they are having multi-dimensional effect. Problem with the LFTs, problem with the bone marrow. Okay, there are things which are, there is a big chapter, you can say that thing, which are related to anti-epileptics. The LFTs, they are, some of them has enzyme induction or enzyme inhibition. Okay. Then there is bone marrow suppression. So there are so many things which are related to anti-epileptics. Then another important thing is that the drug levels. Okay, because if even if it is like a patient does not have recent fits, still they can have, if the, for example, you forget to mention clearly that the patient should be taking epileptic medications like routine, and they miss skip the dose because they were fasting. Okay, so maybe the patient can develop fits. So because it's like a part of diet. It's a anti-epileptic medication is just like tea or coffee for that patient. So it needs to be continued. So this is something very important. Okay. And then, of course, sometimes it is difficult to handle. Another thing, all the pediatric concerns, especially I will highlight with reference to the IV line. Okay. Because IV line will be a big challenge. You need to have inhalational induction. And for example, if a baby, a syndromic baby, now you don't have IV line. So there are so many things which you need to know only for MRI. Okay. Only for MRI, you should be knowing all these things, or you should keep these things in your mind. Okay. So like, and you should have troubleshooting for everything. Like if there is problem with the IV lines, you can have amlachrine, you can have intramuscular like ketamine, you can have nasal midazolam, you can have nasal fentanyl. There are so many Presidex. There are so many things which can help you in achieving this thing. But actually, eyes cannot see what mind does not know. So you should be knowing what can be the possibilities. Otherwise, you unfortunately you will miss something and you will be in trouble. Okay. So that's why, like you just have to think and you have to act accordingly. Okay. There are so many other things for IV line, vein visualizer, then inhalational induction, and you need to have at least one person when dedicated. Because, for example, if you are the lone anesthetist, for example, it will be big problem for you. Because if you give the airway to other person, it will be a problem. If you take the give IV line for him, maybe he suffered. So it's a big problem. Then if you happen to have a very chubby, very cute baby, that is very good for everyone else than anesthetist. Because the more chubby baby, the more problem is in on board. Because there will be too much problem with the IV lines. And the basic, remember one thing, if you are able to handle the airway, don't manipulate airway till you get the IV line. I highlighted this thing when we were discussing about airway. I'm just recalling again and telling you that never manipulate the airway till the time you have IV line and you have secured the IV line. Usually, it is not a painful procedure. It's just you just need to blunt the sympathetic stress response. You can use some lidocaine, you can use propofol, and you will intubate the sorry. Usually, these patients in majority of times they don't need to have intubation unless there is a specific condition in which you have risk of aspiration. Then you will never take a chance and you will intubate the patient. But otherwise, usually in majority of cases, we are putting supraglottic airway devices, LMA or iGel, and we are doing it very successfully. Okay. But this is the thing. Then the rest of the things, you don't have access to the patient. You are sitting outside. You should have good ECG coming. You should have end-tidal CO2 coming. You should have you can sit, because of course you cannot stand inside for a long time. So usually there's a screen of the monitor connected and you are sitting outside, and you are just monitoring the patient away from the place. And then you have to, because if you are not giving muscle relaxant, for example, then it is like difficult to maintain the level of anesthesia. Maybe after inhalational reduction, you can switch to TIVA. It's a possibility. You can keep an infusion of propofol or like any medication which you can use for as a TIVA. But again, the thing is that the balance needs to be there. If you give too much anesthesia with the aim that the patient does not move while the patient is inside, the problem will be still that as soon as the MRI film finish, then you need to bring out the patient. So there's something very important. Okay. Then another thing which I have not told you up till now is contrast, a big problem. Okay. Contrast induced anaphylaxis, contrast induced nephrotoxicity. Okay. So you should be ready. You should not let they usually it's a part of their protocol that they always have a creatinine level, but still like you should be knowing that if they are giving the contrast or no. If they are not giving contrast, say thanks. Say thanks to God that you are not you are one step up, because the examination will be prolonged relatively, because what happens usually, what is the routine, that they do the scan and then the doctor will call the sorry the MRI technician will call the doctor. Is the scan is good? Do they need to give them contrast? And then they give the contrast, and then they have another image. Okay. So these things you should be knowing, that whenever they are using contrast, they should be knowing there can be allergy. So you should be anticipating for any problem like that. Okay. So these are the basic things, but then in the MCQs pattern, you can have how much noise decibel you can. This is just a number. I think around 70 decibel, if I'm not wrong, because numbers like slip out of the mind. But the basic theory is that usually they put something like headphones which protect from the noise. Otherwise, the patient can have the problem like that. Okay. So then another important thing which you should be knowing is quenching. Okay. This is with relation to the like MRI dysfunction. Okay. And the problem is that helium is released. So there should be, and there is a system of monitoring release of helium. Okay. Because suddenly if helium is released, there will be hypoxia, not to the patient, but to the environment. Okay. And there is an oxygen sensor, and of course there's a mechanism by which they are monitoring it, because if there is any malfunction, they need to quench. Okay. And the helium will be released. So this is something you should be knowing, that there should be oxygen sensor, and you need to abandon the scan. Of course the scan will be abandoned, and even if the patient moves a little bit, maybe the scan will not be successful. So you need to do the scan from the start. Okay. So these are the challenges which you have. Then the terminologies you find will any book, MRI compatible and MRI safe. You can read them in the books. This is not nothing too much big. And then another is because I'm bad on that numbers. There is one Gauss and one Tesla. So I don't remember which is big one. One unit is big one and one unit is less one for MRI, uh, like this one MRI area. Okay. Quenching may also cause hypothermia. Uh, I think yes. I am not sure about it, but usually the environment is very cold. Okay. Because they have to keep the patient, the machine is sensitive. And if the temperature in the environment is not cold enough to keep the machine quiet. Otherwise, machine will start fighting with the
Sir,
environment. Yes.
the most dangerous problem with quenching is hypothermia, because quenching will cause a lot of cold temperature in the room, so the patient will have hypothermia.
Okay. And also helium release. Okay. Because helium will be released in the environment. Am I right or wrong?
Yes,
It's
yes,
correct.
sir. Yes,
Okay.
yes, sir.
So this is something. So this is important thing. Then what I was saying. Mm, okay. Anything I missed with reference to? Yes, yes. I was. What is the working principle of MRI? Can anyone tell?
So magnetic waves are captured.
Yes. So actually, there are two fields. One is fixed, okay, and one is constantly whenever there is a magnetic field, protons are aligned, okay, and then it is switched off, protons come down. This dancing activity of protons going up and down, up, down, up, down, up, down will be different in different tissues, okay, and there is something which is recording it. So if don't try to learn MRI mechanism more than this, because if you try to learn more than this, you will forget everything. This is just a kidding remark, but the basic principle is like that. One field is constant and one constantly switch off and switch on, okay, and there is something which recording it. So when that the this dancing activity of proton will be different in different tissues, okay, they will be behaving in a different way in different conditions, okay. So this is the working principle of MRI. So let's see, I had opened a number of papers with reference to MRI. The basic things I have told you, okay. Mm, So one Tesla is equal to 10,000 Gauss. So Tesla is a bigger unit. This was I was just telling. Okay. And the I have told you the problematic problem, but usually there will be any neurological problem like stroke, hemorrhagic stroke or ischemic stroke or anything like that. And not only this is not only with for brain, there may be some vascular problems. There may be even there are some MRI guided procedures. Okay, there are not it's not done everywhere, but there are some procedures which are done in the MRI suit. I have never seen it, but I've just read about it that there's a number of procedures which are being done under MRI. Okay, so presence of a strong magnetic field, ferromagnetic objects. You should not remember one thing. Another for the people in the MRI suit, don't carry your credit cards. Don't carry your car remotes. Okay, because I have faced one of my colleague. I was going with him, and when we tried to switch on the car was dead, and we thought that there is something wrong. The car was taken by a big it was need to be good, and that they found that it was because of MRI. Okay, the remote lost its function. So you see that's why the credit card, mobile phone, SIM cards. So don't take them inside. Okay, so these things should be MRI compatible. Sorry, whatever is nearby, it should be MRI compatible. Okay. So implants and foreign bodies, as I maintain, there could be cochlear implants, intraocular metallic foreign bodies, ferromagnetic arterial and aneurysm clips, because there will be, and there are actually both sides. There are some machines which are less offensive, and there are some prostheses or these things, implants, which are less aggressive. So they are trying to have something in between. But this is in the exam. I don't think so. You don't need to know more than this. Okay. So I think that's the basic information you should be knowing. Yes, if you just there, because if you see the maybe endotracheal tube does not have any metal, but there is a metal in one of the part of endotracheal tube. Do you know what is that part? That is the balloon. Okay. There is a spring over there. So you will see that they just put a tape over it. Um, I never understood that how that is not creating a problem. but that's usually what we do. Okay, they just put a tape over it. And there are incidents of burn. There was one case report in one case incidents in our hospital where it was like there was burn with the pulse oximeter. The normal pulse oximeter was there and there was burn. Okay. So restricted a high level of scavenging of anesthetic gases. Usually it's not there. Okay. And what else? Quenching. So we can have some words about quenching. Quenching is a process involving the rapid boil of the cryogen that causes an immediate loss of superconductivity. This may occur spontaneously as a system error during installation, services, or power-ups, or may be deliberately induced in order to shut down the magnetic field. If this happens, the magnet will be lost and large volume of helium gas will be produced. This is normally vented to the atmosphere through a quench pipe, but still you should be knowing about it. In the event damage to quench pipe, the buildup of helium within the scanning room could potentially lead to the nothing will be happening to the patient, but the staff will be asphyxiated. Okay, so there should be oxygen sensor. That's what I was telling you. That all people will have hypoxia. Okay, so nobody will be able to tell anything to outside world. Patient will remain. The baby will remain on auto mode. So this is something very dangerous. Okay, and actually, once upon a time, few weeks ago, I sent this question to the WhatsApp group that what happens without, because and everyone was answering about the patient, and this was the alarm in the environment and it was related to quenching. Okay, so they this question may be asked to in the exam, because I never saw this thing being asked before, but it just came into my mind that this question may be asked. Okay, so contrast, as I mentioned, I think I have told majority of the things with reference to MRI, okay, claustrophobia and seizure and conduct of general anesthesia. Actually, mm, okay, mm, yes, patient may be coming from ICU with hell of infusions going on or things like that. So there are actually pumps which are specific. There are specific anesthesia machines which are compatible in that room. Okay, uh, so I think that's it about MRI. Okay.
So can we discuss anesthesia in a dental clinic?
Dental clinic. Yes, you are right. Actually, these days, what I have started doing it that I try not to go beyond 30 minutes. Okay. So there are so many places where we have a NORA environment. So we will just have a look and maybe in coming sessions, because I think dental anesthesia I have not discussed in much times, but I think not today, but inshallah I will do it. Okay. I will do it. So
Yes,
usually you see the radiological suite, cardiac angiography, interventional radiology, CT scan, MRI, endoscopic suites, dental clinic, burn unit, ECT, lithotripsy. Okay. Uh, this is something also sensitive. There are so many other factors like you will be there. I have seen many anesthetists getting angry that when you are going to this suit, they don't let anyone having uh, body spray. You can have a smell of your sweat, but you cannot have a body spray. So because OVA are sensitive, there is some problem with that one. Okay, so the same this is actually from update in anesthesia. Okay, update in anesthesia and which year it is? It's not mentioned here. Okay. Anyways, this is in the MRI. This one. In the article folder. It's there. Okay. So remote area journal concern is equipment, staff, procedure, patient, and then you can go in details. There will be, as I mentioned, there will be specific patient population over there. Okay, so elderly patients or any patients with something. Yes, of course, one component will be for the trauma. Okay, and this will be one component. Like for example, MRI for knee for some sports injury. This will be one category. That will be usually not cluster if unless the patient is having any problem, because MRI knee you will never find. But still, if MRI knee is being done for a baby, maybe you need it. Okay. If any orthopedic uh, procedures may need anesthesia, other in even in pediatric population. Okay. For other than neurological problem. So okay. Mm, yes, design of the anesthesia machine may not be familiar. For example, the position of oxygen flow meter may be on the left side, okay, UK standard rather than right side USL standard. So I have seen it, though it's a big problem. The machine, Fabius something, I don't remember. I'm very bad in remembering the names of the machines, but there is one specific machine which I have seen in majority places of MRI. Okay. Then another, I just wanted to tell you that there is there are some neuro suits in which MRI machine is installed there inside, like you could say MRI is in the OR. So the patient, after anesthetizing, they are shifted for an MRI, and post procedure they do an MRI. Okay, so I have conducted those very special and specific cases in King when I was in King Faisal. So there was an MRI suite I have never seen anywhere else. So it was the only hospital where we used to have those cases lasting for 10 hours. Okay, so there are so many things in addition to that in that specific. I will discuss someday, inshallah. Okay, so uh, okay, so I think I will stop here today, and we will continue with the some of the other aspects of some of the other places where we actually perform non-operating room anesthesia. One of them is endoscopy, and as Zishan mentioned about dental, we will also have some words about the dental anesthesia. Okay, so any questions before we finish? Okay, so thank you very much, all of you, for your presence. And inshallah, we will continue our discussion tomorrow with reference to NORA. Okay, Zishan, thanks for coming. And I will try to have like a dental, otherwise, and maybe I will do ERCP or endoscopy tomorrow. Okay, so thank you very much. Bye bye. You know Ijaz, Dr. Ijaz, who was recording. So Dr. Ijaz, you will find all the recordings in the YouTube channel. Okay, anyone who is not in the WhatsApp group, like I will just write my number over here, and you can this one send a message, because I send the message to the Facebook as well. So people who are joining via link from Facebook, they can just note down my number. You can oh no, just a sec. You can see in the chat box. So this is my number. So you can give me message. You know, the basic purpose, I again repeat, my intention for all this is nothing else than I love anesthesia more than I used to love yesterday. Okay. And this is my message to everyone. Whatever you do, try to love it, because the thing which you enjoy, you will have better control. Okay. You just send me a message on WhatsApp and I will send. It's anesthesia knowledge. Okay. It's the channel name is also anesthesia knowledge. So you can find. Okay. So any question, anytime, you can just drop a message on WhatsApp and I will be happy to answer you. I just write my number in this chat box. So thanks a lot for honoring me, because sometimes people think the person who is giving the time, usually because I have seen people don't try to spare time from their lives. Of course, everyone has family, job, social life, medical problems, so many things. But remember one thing, if you just try to think that maybe someone can be benefited, this is number one. And another thing I tell you, it's a two-way traffic. If I can recall everything, even after appearing last exam, maybe 6 years ago, still, if I can recall these things, this is just because I'm in touch with you people. So my suggestion will be wherever you are, try to spread the knowledge. The best way to learn is to teach. The thing which you learn and you teach to someone, you will never forget. Okay. This is my message. Please spread this message to everyone, because we are in you can say in time of our lives that we never think about others, and that's why we are becoming so selfish. We only thinks about ourselves, and that is the reason for decline overall in society, everywhere, wherever you are. Okay. So thank you very much. I hope you all are happy, and again, thank you for coming. See you tomorrow inshallah, same time. Assalamu alaikum.